Welcome and thank you for joining us on today's webinar hosted by the National Center for Pyramid Model Innovations. My name is Alyssa Rausch and I am with NCPMI. I'm based out of the Positive Early Learning Experiences Center at the University of Denver. We will have a Q&A time at the end of our presentation where we will address as many of the questions as we can. We also have our contact information available for those questions that we do not have an opportunity to answer during this webinar time. This webinar is part of the Within the Framework series, and today's topic is digging deeper into inclusion in Colorado. I am joined in this presentation by Sandy Link, Marcia Blum, and Heidi White, who lead the preschool team in the P3 or P through third grade office at the Colorado Department of Education. They are the providers of professional development and technical assistance. Welcome to our presenters and to you, our attendees. I am going to turn this over to Heidi to get us started.
Thank you so much, Alyssa. It's great to be here. The bulk of today's presentation includes findings from a study conducted by the Pele Center under a contract with the Colorado Department of Education. Before we share about the study, I want to take a few minutes to offer some context about what drove our team at the Colorado Department of Education to engage with the Pele Center to look more deeply at inclusion of preschoolers with disabilities in Colorado. In short, we believe the study findings have national implications for the utility of Indicator 6 data and quality improvement efforts related to inclusion. As many of you are aware, the national status of inclusive programming for preschoolers with disabilities hasn't changed in several decades, and the national picture of preschool inclusion is not particularly impressive. The pie chart at the top of this slide reflects the national average of preschoolers with IEPs served in classrooms made up of at least 50% typically developing children. Nationally, 42% of 3 to 5-year-olds are educated in these settings, while over 57% receive their special education services in non-inclusive settings, such as separate schools or segregate classrooms. This has not changed significantly over decades, despite what's known about the advantages and positive outcomes of inclusion and as demonstrated in research. Importantly, even when children are accessing regular early childhood programs, use of the regular early childhood program setting code allows for up to 50% of the special education and related services to be provided outside of that regular early childhood setting in pull-aside or pull-out models, a practice that we know doesn't fit within a framework of high-quality inclusive practices. To drill down a bit from the pie chart on the previous slide, while you won't be able to see all of this detail clearly, this bar graph shows the rates of children receiving services for at least 10 hours a week in regular early childhood settings, shown in the yellow bars, and the proportion of children who receive at least 10 hours a week of services in another location, meaning separate programs, service provider location, segregate classrooms, etc., shown in the blue bars. Each state and territory is represented here. Colorado is a top performer on this indicator. We have a rate of inclusion more than twice that of the national average, about 86%. On this chart, our performance is drawn out with the red arrow and box. Several US territories are rated higher, but we lead all states on this indicator. A major contributor to Colorado's performance on Indicator 6 is Colorado's dedicated state funding within our public school finance formula to fund 10 to 12 hours each week of general education services to preschoolers with IEPs. Preschoolers with an IEP are typically placed in classrooms administered by school districts, alongside preschoolers eligible for our state-funded preschool program. These are children at risk of later school failure. This program serves about a quarter of all of our state's 4-year-olds and about 10% of 3-year-olds, with 10 to 12 hours per week of access to preschool. School districts are expected to offer blended preschool programs serving children at risk alongside those with disabilities, oftentimes also including children funded by Title I, Head Start, or families who pay tuition. As a state, as we reflected on Colorado's performance, we observed that though it was strong when looking at the indicator 6 data, the data doesn't adequately reflect all of the components we know represent high quality inclusion. Preschoolers are being given access to at least 10 hours a week of programming with typical peers, but the classroom composition in many instances approaches 50%, meaning 50% of children with disabilities. Though we know that inclusion is best when it resembles proportions in the general population of around 10%. We also continue to see and hear that many service providers deliver services in more segregate ways, even when children are enrolled in inclusive classrooms. For example, when a child is pulled out of the classroom to receive services or aside from the rest of the class, sometimes with other students and sometimes not. In any case, the benefits of full inclusion are not being fully realized. Our conclusion was that access to a general education setting by itself does not equal inclusion. In fact, the federal policy statement on inclusion, issued jointly by the HHS and Department of Ed, refers to many dimensions of inclusion beyond educating children with typical peers. We did not have appropriate ways to measure the other aspects, which include holding high expectations for all students, promoting participation in all learning and social activities, individualizing accommodations, using evidence-based services and supports to foster development, friendships, and to nurture a sense of belonging. Because the data collected by OSEP shown on this slide to represent least restrictive environments in preschool doesn't reflect our particular values about inclusive services and composition of classrooms, we sought to learn more about the practices that service providers utilize in the provision of their services. For these reasons, we partnered with the Pele Center to learn more about the extent to which high quality practices were being implemented within inclusive early childhood programs across Colorado. This chart is a closer look at all of the indicator 6 setting codes in Colorado. And again, on the surface, we're proud that most children are represented in regular programs for more than 10 hours each week, though we aren't seeing that it has made a real difference in children's outcomes. Our indicator 7 data, for example, is right around the national average, even though our rates of inclusion are twice the national average. We began to ask some deeper questions and wanted to learn more about other aspects of inclusion referenced in the literature on high quality inclusion. Some of those questions include, are LRE decisions being made on the unique needs of children? To what extent are children being excluded from classroom routines and instruction while services are delivered aside or in a pull-out model? And what influences providers' decisions about whether services are embedded in classroom routines? To what extent are placement decisions beginning with a discussion of where the student would be if they did not have a disability? We discussed these questions within our team and with our preschool special education advisory group many times. We don't have consistent and standard ways to help us consistently answer these questions. We believed a more systematic way to collect this information would inform our technical assistance and professional learning efforts. And so we turned to the Pele Center to partner around a study related to this. Next, Alyssa will share a bit about what the study involved, how it was conducted, and what was learned.
Thanks, Heidi. So we did at the Pele Center receive the request from CDE to better understand these questions, and we landed on 3 research questions to support CDE in these efforts. The first one being, we wanted to know if services are being delivered, not just actually in the classroom, but are they embedded in classroom routines and not outside of those routines, for example, in the back of the room or in a hallway. Additionally, we wanted to understand more about how placements were determined when a child qualified for services or entered the system. And lastly, we wanted to know the barriers that prevented children from being placed in inclusive settings. So we gathered our data in 2 phases. The first phase included a survey that was sent to all early childhood special educators and related service providers who work with preschool-aged children in Colorado. This included speech language pathologists, occupational therapists, school psychologists, physical therapists, etc. We received 444 responses to that survey that covered each and every administrative unit in the state. So it was a really nice landscape for the entire state. The survey had both Likert scale answer items as well as open-ended questions. So we got a lot of good information. The second phase of the study, we were able to interview 23 administrators across the state who oversee preschool services and ask them to share with us the specific barriers that they experienced in placing children in inclusive settings and supporting providers to deliver interventions within natural routines. It was within our scope of work to do a bit more than 23 interviews, but this thing called COVID got in the way. So, so we were a little bit, that number was lower than we had hoped for. The data that we collected and analyzed across both the surveys and interviews led us to 7 major findings, which are listed here. I want to share some important aspects of the data that emerged from each of the findings, as well as our recommendations for how these findings could be addressed. The recommendations came largely from the ECTA, Early Childhood Technical Assistance Center, and NCPMI's Indicators of High Quality Inclusion initiative. The indicators were designed by a group of national partners to support state leaders, local administrators, frontline personnel, and early care and education system. The indicators illustrate the most exemplary practices for inclusion of children with disabilities, and they do so across the state systems, community levels, program levels, as well as in the environments where children are served. The indicators can be found at the link on the event page, and they'll be in the Q&A chat at the end of this as well. Immediately, so what you're going to see in these findings, what you're going to see in how I report this out, is that we make recommendations at different points to providers, to administrators at the local and community levels, and also at the state level. So immediately, some of the data that rose to the top of the survey and interviews centered on the need for increased collaboration. And I'm sure this is no surprise. According to the Division for Early Childhood Recommended Practices, the quality of relationships and interactions among adults affects the success of programs. Collaboration promotes and sustains adult partnerships, relationships, and ongoing communication to ensure that programs and services achieve desired family outcomes and goals. Here is some of what we learned. We learned that 65% of education providers, special education providers, and related service providers had a caseload of over 25 students. Almost 30% had a caseload of over 50 preschool age students. Over 75% of the early childhood special educators dedicated less than 5 hours a week on average to consultation, and much of that consultation was done on the fly while they were delivering direct services. Administrators across the state indicated that they really did not have strong policies and procedures within their programs to support collaboration between providers outside of professional learning days that were once a month or quarterly. Based on these findings, we recommend that providers are given strategies, time, and space to support communication of information regarding children's needs, their strengths, and their programming goals with all staff members. Another thing that we noted was that there was a real dispositional piece for all the providers as well. Providers need to be encouraged to be willing to share their role with other team members and accept responsibility of other team members in order to benefit all children and families. For example, special education and related service providers need to support other personnel to implement IEP objectives. They can't do it all. And we also know that general education providers need to be afforded the opportunities to embed the strategies from related service providers into their own learning environments and into their natural routines and maintain relationships with children with disabilities. We recommend to administrators to establish a staffing structure that allows for collaboration between all providers. And what we also know is that administrators themselves need support and opportunities to share with one another at the administrator level the innovative and exciting policies that they have developed to make this successful. Also emerging from both phases of the study was a need for genuine and authentic family partnerships that place families at the center of the decision-making process. Equitable placement decisions need to represent the child and family regardless of their ability status, race, ethnicity, culture, home language, geography, socioeconomic status, family composition, or other identities. Being pressed to deliver services, 83% of providers suggested that they just didn't have time to take time to invest with families as they know they should. And administrators stated that they were strapped by barriers that prevented families from being deeply involved in placement decisions. We recommended to providers that they include that families be asked how they want to participate in a culturally linguistically affirming ways. We also encouraged providers to create an environment of bidirectional and open communication using a variety of strategies that is reflective of family preferences. So that could include in-person, paper, on the phone, electronic, email, text, app, and to really make sure that not only could providers share information, but that families could also share information about their child. Administrators are encouraged, among other things, to intentionally partner with families in activities. This could include activity efforts, public awareness, forums on inclusion, and conferences, and that families should be included in a regular problem-solving and decision-making processes at all points. Expanded community and state partnerships are also of key importance. There is an increased need for intentional partnerships between school districts and community programs to serve children with disabilities, as well as de-siloing special education and regular education initiatives at the state level. This is particularly true when children receiving different funding from different streams are served in the same setting with the same providers. Again, here, administrators noted barriers such as space, time, and professional development within their own silos. A direct quote from an administrator said, "Classroom space availability will drive where we place kids based on how we've clustered a certain amount of children with IEPs in different classrooms." In this area, we made recommendations to administrators and at the state level. Both of these levels are asked to develop shared visions on inclusive services and develop and maintain agreements with other agencies, sectors, and partners that allow these systems to collaborate in a cross-sector way. It will also allow them to braid funds and share resources, including professional development and coaching resources. Overall, we noticed that there is a need for increased use of evidence-based practices for children diagnosed with disabilities. This includes developmental delay, autism, and communication disorders. While general education providers desperately want to work with children with disabilities, it was noted that they lack the specific skills necessary to do so. Furthermore, administrators indicated that formal training and staff professional development primarily centered on licensing and regulations from the state, things like universal precautions, first aid, CPR, child abuse, and that left very little time for support with high quality inclusive practices. So for this particular finding, we made recommendations to providers, administrators, and state level agencies. We encourage providers to modify their environment's materials instruction to ensure that children can engage in the general education curricular activities and achieve their own individualized goals while doing so. Among other things, administrators should evaluate the effectiveness of the professional development and collect data on the impact of the adoption of the use of professional development in evidence-based inclusion practices. At the state level, leaders should work collaboratively with programs to identify and coordinate funding streams and resources for cross-sector and statewide professional development. This includes the statewide coordination of access to coaches, mentors, and consultants. This study validated that increased training and coaching is needed on challenging behavior, a very important intersection with pyramid model. As we all know, challenging behavior is a significant reason that children are placed in segregated settings. Evidence from both providers and administrators confirmed that challenging behavior was a major contributor to children not being included. Behaviors that resulted in segregation ranged from just high levels of distractibility to difficulty processing language to children harming themselves or others. We heard lots of quotes similar to this, but here's one. Every one of our sites will take a child with challenging health issues or cognitive delays. The hardest thing for us is providing supports for children with behavioral concerns. We heard this over and over again. It is recommended that providers intentionally teach a range of social emotional skills and that they do this in large group, small group. They use a variety of materials to do this, and that they support the learning of emotions, problem solving, entering play, taking turns, and having healthy and enjoyable interactions with their peers. For those of you familiar with the pyramid model, these are fundamentally pyramid model framework practices. Administrators should be sure to address policies and procedures that ensure that there is a team-based approach used to understand individual children's challenging behavior. And here we're really talking about tier 3 supports that adapt the environment and plan individualized instruction that strengthen the child's emotional skills and also limit their challenging behavior. There is an increased need for guidance and public awareness about children with disabilities and their families that is based on where their child would be placed if they did not have a disability. Heidi alluded to this earlier. With a great many demands on the workforce, providers of all type are stretched in every way to serve diverse children. Additionally, it can be challenging to ask providers who have done things one way for a long time to reframe their work. And this was clear in the data that we collected from both providers and administrators. So at this level, the level of public awareness and guidance, we made recommendations to administrators and state level agencies. We asked them to focus on examining attitudes, beliefs, implicit and explicit biases that lie beneath all of their decisions and policies. We encouraged them to participate in visioning, action planning, and data collection and analysis, looking at the implementation of inclusion at the local and state level, and to use that data to support marketing and ongoing public policy. Public awareness leads us to the last finding, and it has to do with what we lovingly refer to as the F word, and it's not going to surprise any of you. Providers and administrators alike talked about the need for funding. In addition to requesting that IDEA be fully funded at the federal level, at the state level, Existing flow-through dollars should be available for local allocation and management of services to support individual context of local programs and the children that they support. We heard from administrators and providers alike about astronomical caseloads, travel times, space limitations, finding general education placements for all children, addressing the ongoing workforce challenges around training, compensation, and retention. We recommend that administrators develop collaborative agreements to efficiently and effectively cost share, braid, and/or layer funding to support children with disabilities in the setting where they would be if they did not have a disability. And at the state agency, we ask agencies to support policymakers in understanding the legal and ethical reasons, as well as the scientific knowledge that can be used to leverage funding to support children with disabilities in inclusive classrooms. Now that you have a brief understanding of the results of the study, I am going to turn this over to Sandy and Marcia from CDE to talk about next steps.
Thanks, Alyssa. We at CDE have long felt that teaming and collaboration between special education and general education was critical in helping to promote inclusive practices to occur in the classroom in support of better outcomes for all children. We have targeted ongoing work with medium and smaller districts whose indicator 6 and 7 data was low. That work supporting teaming and collaboration spurred us on when we joined with the Pele Center to actually research those factors and provided a foundation for many of the questions on the study survey. As a result, the study has elevated the awareness and importance of working on inclusive practices across all providers in our state. We have reviewed and had in-depth discussions with our preschool special education advisory committee members around inclusion, indicator 6 and indicator 7 data. And part of the impetus, drivers, and support for engaging in this study came from this committee. We have shared data from the study and specifically curated their input on a regular basis and their recommendations for future planning. We started last spring with Phil and Alyssa sharing information at our state meeting about the study and the preliminary data. It was especially encouraging for participants to realize that we had results from over 400 participants who responded to the study. At each of our 9 regional meetings this fall with state leaders, we had individual presentations to groups centered on many of the key findings, but particularly key finding number 1, which is around that teaming and collaboration. We provided suggestions and references to the inclusion indicators. We had a special webinar presentation by Phil and Alyssa as part of these meetings, sharing about inclusion and how the results from the study are critical to our future success in implementing high-quality inclusive practices. The study recommendations have propelled us to meet and guide our work with state partners, and the study findings are driving our professional learning content. We have been focused on indicators of quality inclusion as a state for many years, and we are currently raising awareness to the indicators of high quality inclusion on the ECTA website and interweaving them into our trainings and conversations with partners and stakeholders. One of our main focuses, as I've said, is on teaming and collaboration to promote inclusion. It is an indicator at both the community and local program levels. We have been encouraging staff to not just be aware of the indicators, but what does it mean to successfully execute them? Starting with intentionally building practices around making LRE decisions. For instance, who needs to be at the table for those decisions? Whose voice is critical in deciding what implications are for the child, their family, the classroom, and the teacher in that placement? And how can the child be meaningfully included in the classroom? Hopefully teams will do a better job partnering to actualize those decisions and collaborations by focusing the field on the implementing of the indicators and what they truly mean in practice. We feel strongly about building leadership practices focused on self-reflection to question what does it mean to embrace inclusive practices, and what does it involve in planning and implementing those services, and to also question themselves and their staff about what do we want inclusion to look like in our program, and how do we incorporate people's dispositions and attitudes into making inclusive practices successful for all. We are working with the Pele Center to begin to build a state team to help align with the study findings, as well as the HHS policy statement and the Children's Equity Project report. CDE as a state education agency has a role to uphold federal guidelines, but we know for fully inclusive practices for children starting at birth, it is important to strengthen the partnership with our CDHS partners to ensure connections to broader systems and policies, including QRIS, child care licensing, Colorado child care subsidy programs, early intervention, Head Start, and the Colorado PDG grant. We are presently just starting work with a smaller state team planning for convening a larger group of players. Our focus right now is on raising awareness and building buy-in at important junctures of our work that are currently barriers for children, families, and agencies to inclusion. We are working on building understanding of how everyone has a place at the table in this conversation, and we all need to be able to figure out where we sit, as well as understanding and embracing our role in the process. We will be working on creating a team vision outside of the strictly state agency role of individuals, with a mini action plan to build cross-agency alignment related to inclusion. Marsha will now take us forward in looking at our specific professional development and additional steps for us.
Thanks, Sandy. The next step, number 4, is really around professional development across systems. And at the state level currently in Colorado, we offer professional development through CDE that is basically tiered based on the local education agency's need. We offer a variety of opportunities open to anyone based on Colorado-specific issues within our learning management system. Our state team uses a more targeted approach for technical assistant based on the needs that are expressed by the field. We also offer intensive year-long supports to programs that have a need to improve efforts in inclusive models of assessment and intervention that are developmentally appropriate with an emphasis on the whole child and definitely grounded in social emotional learning. We want alignment of what is offered by the state to what the LEA priorities are so that programs can provide coaching and mentoring for implementation. Some very important aspects of these next steps that are reflected in the slide are to build knowledge, skills, and dispositions of practitioners and administrators. We need to support administrators in the planning of effective PD and PD activities at the local education agency level, while also supporting preschool practitioners' access to higher education, all to elevate the workforce. Itinerant special education providers really need support in PD on service delivery models, co-teaching, and partnering that is supported by local program administrators with the changes in scheduling, space, and resources that go along with these initiatives. But the really big idea here, and it's what's also recommended by NAEYC, is that local communities leverage existing resources. We need to actively engage family members and the broader community in all aspects of program planning and implementation that includes PD activities across the system. Local communities need to recognize and take into account the systemic inequities there that can make it difficult for members of traditionally marginalized groups to participate in the training and education that they may offer. LEAs need encouragement to cultivate relationships with community resources, including local libraries, museums, public parks, physical and mental health consultants, and government services that can support their program and include children with disabilities and their families within the community. These connections will serve children with disabilities throughout their educational career and into adulthood. What we really need when we're are looking at teacher credentials, and that there are sufficient numbers of well-prepared and well-compensated teaching staff to provide the individualized attention needed to implement high-quality early learning experiences. In Colorado, We have teaching standards for our higher ed programs for early childhood practitioners that address inclusive practices. However, a degree and/or teaching license is not always required for preschool employment. The minimum requirement for a preschool teacher in early care and education in a program in our state is currently one class on child development. This is true of our private sector community child cares and our state-funded program. This makes our QRIS and child care licensing the leverage point. We need to ensure teacher credentials in these systems require courses and trainings on inclusion to expand opportunities for children with disabilities. As mentioned, in Colorado, our ballot measure was passed to provide universal preschool for 4-year-olds. Qualifications for preschool teachers is at a very high priority in these design discussions. So, rounding out our plans is to really identify who is implementing inclusive practices and who wants to continuously improve upon those practices. We'll be using the survey and interview data from the study to understand what frameworks are in place when it comes to how inclusion indicators are being utilized or demonstrated. We may create some new models. We may be able to develop practice profiles to guide the work of others. We also want to crosswalk data of what we know from the study about service delivery models in different programs with the LRE Indicator 6 data, including what percentage of children with IEPs are in classrooms across the state. Also looking at Indicator 7 outcomes so that we can have an idea of the educational benefit for children within those different models. We also know that some programs in Colorado use early childhood special education teachers as the classroom teacher. But what are the other influencing factors in these programs that lead to the outcomes that they are experiencing? As we move into the future, universal preschool for 4-year-olds may influence state, community, and local site implications for the community continuum of services that are available to preschoolers, and therefore the importance of the community in much of our planning. Lastly, we intend to continue to collect data from phase 2, which are observations in classrooms with classroom level indicators to inform our decisions. We may need to wait until after the pandemic, but this is an important information to collect to fully understand what these LRE placements are and the implementation of inclusive practices within them. So now we'll move on. We've finished up with a lot of this, and we'd like to move on to any questions, and we'll use the Q&A panel to submit your questions and answer those if you have any.
One just popped up here that I see.
I would say I'll go ahead and answer that. We spend a lot of training and professional development on transdisciplinary play-based assessment. And transdisciplinary play-based intervention, as well as social emotional learning in programs. So those are some of our more intensive year-long experiences that we're providing and opportunities for teams to come together and really explore deeply these kinds of topics. We also do, as Sandy had mentioned before, quite a bit of focus on teaming and collaboration.
I think that that's a really big piece of really giving people some skills and learning how to team and collaborate in building relationships. We also do have courses on helping, these are the courses on our learning management system, but talking about instructional strategies and blended practices, as well as developing functional participation-based high-quality IEP goals.
I see a question too here related to whether we've had any issues with regard to IDEA funding and state funding. We really have not. I think we've been so fortunate to have a state legislature that decades ago allowed school districts to generate per pupil operating revenue for children who are identified with a disability at a preschool grade level so that they can access general education. And then we use the IDEA and additional state special education funding to support the specialized instruction and related services that build on top of that. So That, I think, has been truly the linchpin in the performance of Colorado, looking at the Indicator 6 data the way it's currently collected.
I would also add to that we certainly expect programs to blend their funding sources and then therefore to blend their interventions and instruction alongside that. So it really does create an enabling context for an inclusive classroom.
We have a couple questions in the chat, actually, Marsha. One says, what do you establish, require, or recommend to the programs in terms of ratios of children with and without IEPs?
Well, our publicly funded preschool classrooms are to exceed no more than 16 children. So with this, our least restrictive environment expectation is that no more or than 50% of those would be children with IEPs. That's the bare minimum. We certainly would encourage a smaller percentage of children with IEPs in those classrooms. And in fact, in many areas in rural communities, the ratio does reflect the community. But in some of our larger systems in more urban areas, they tend to flirt with that 50-50 ratio quite a bit, but it's 16 children in a classroom.
And I think we would encourage that, again, that natural proportion. So whatever is natural within the community, which can be anywhere from 2 to 5%, that's ultimately what is reflected. We know that is challenging because of the number of seats that are available, but that's, again, when innovative decisions can be made around how to open more seats that are in the community to children with disabilities, so that natural proportions are closer to things that we can achieve.
And I'd like to circle kind of back to that number of 16 children in a classroom. That's actually with 2 adults. So we would have a teacher and a teaching assistant being the base classroom team, and then the special education teachers and related service providers also then go into the classroom. So there are very often in a high functioning program, we would see more adults than two per 16.
And I wanted to mention that this is distinct from the child care licensing regulation, which allows for up to 20 children in a group size maximum for the same age group, which is one of those tensions, honestly, that we discuss with our Department of Human Service partners in terms of ensuring that families have access to settings outside of those administered by the school system or those funded in community-based settings funded with the public school dollars. So just want to be transparent that those are tensions that we're really working through. And I see a question here about possible public relations initiatives to encourage understanding about inclusion. You know, I think certainly based on the results and what we really knew prior to the study, we always have a strand of work around awareness around inclusion. And so I think certainly we can bolster some of how that's happening, but we actually are doing quite a lot this year, even in sharing the study results and combining that kind of awareness from the study recommendations along with general kind of awareness around the importance of inclusion, the effectiveness of inclusion, the strong research base around inclusion. And so, you know, that is something that we will do and will continue to do.
I just wanted to hop in and offer that the pandemic does pose an opportunity for us to relook at this. There has been some things that we have learned around innovative ways that kids can be included with each other when being in the classroom together is challenging. So in a time where we are always preaching that inclusion is not a place, we've really had to look at that closely nationwide. And so to be able to say that it's not about where a kid is sitting, but it's really more about who are the peers that they would be interacting with on a daily basis, and what are the practices that we need to use in whatever setting to make sure that those kids build meaningful relationships, have a sense of belonging, and increase their developmental domains. So I think in terms of public awareness, there's some good opportunity coming nationally and at each state level to really make headway on some of this.
And then I'd like to, there's a question around kind of an LRE continuum of services. And what we do expect with publicly funded preschool is that classrooms in districts are integrated. However, but when you address the continuum services, there are some large districts in our state who also offer a continuum where some children may be in a segregated setting based on their unique needs. So that is an option in our state. However, I don't think any school districts actually offer classrooms that are in their district that only have general education students in them. They typically would have children with IEPs and children from our Colorado preschool program. That said, they do also, in some instances, offer classrooms that might be more specialized for students with more significant support needs.
I wanted also to address a question that I'm seeing in the chat, which is from Dee. She asks, we experienced situations in which children who were enrolled in community programs are determined to need an IEP and then move to district operated programs, which are also inclusive programs? And the answer is yes. I mean, this is one of those areas that we're really needing to make changes in at a systems level. It's wonderful that we have school districts offering blended classrooms. However, they're funded, as you heard, for 10 to 12 hours per week, excuse me, of service. And many families have a need for full day, full week, full year childcare. And so to have to make a choice about whether they can continue in that community-based setting or access special education services along with the 10 to 12 hours per week of general ed services are not, those are not decisions that we want families to have to make. We are working with programs to be able to allow those types of options more commonly, but absolutely we do see situations where families essentially are asked to move into a school district-based program. And that's also difficult for community-based providers that they don't want to lose families to school-based programs. We do have a lot of communities, however, where the district licensed program for young children is the only program available in the community. And so, you know, it's really a mix across the state.
And I would add that we do have communities that can set up transportation options from families, again, which is not optimal, but to move children to and from a district program and back to a childcare. So those are options as well that are available, but certainly not optimal for families who would like to see their child in one setting, for sure.
Okay, I think if there's no more questions that are popping up right now, I think we'll try to wrap this up before folks head to their next meeting. We wanted to make sure that you knew that in these handouts are all of our contact information. If there's more more questions you have for the CDE preschool team, you can reach out to them with their emails there. If there's more that you want to know about the study or anything, please reach out to Phil or myself, and you can see those there as well. And I'm going to turn it over to Victor, who's going to wrap us up.
Thank you so much to our panelists for their wonderful insights. And your feedback is very important to the work that we do. Please remember to provide your feedback on this webinar with our post-webinar survey. by typing the web address shown on this slide into your internet browser. Your certificate of attendance will appear once you submit the survey. We invite you to visit our website, challengingbehavior.org, to sign up for our upcoming webinars, access recordings, download pyramid model resources, and more. Thank you to our funder for making this webinar possible. This concludes our webinar. Thank you all and have a great rest of your day.